Hi, everyone. I created a post-conference for my students this semester to specifically talk about how we go about discharging a patient. My students did not have that opportunity at clinical, and that was something I struggled with as a new nurse, just knowing who to contact, where to get signatures from, who puts in the orders, that kind of thing. I thought I would be more specific and talk about a diabetic patient because I thought that would give us a nice opportunity to talk about educational needs and specific things that a diabetic patient might need at discharge. So a little bit about my students in clinical setting. I was with second semester associate degree nursing students. I had one male student and 7 females. The youngest was 19 and the oldest student, she was 45. That student was particularly successful in clinical. She's had a lot of experience working as a CNA, and it was really neat to see her coming back to school after she raised her kids to pursue her nursing degree. I did have a little bit of diversity in my group, which was nice. A couple Latino students, one African American, and then 5 Caucasian students. We were at Aurora Baycare Medical Center in Green Bay, up on a medical surgical unit. It was a really good experience for the students. We saw all kinds of patients. The students were able to see different procedures, just a nice variety. So overall, we had a great experience up there. But again, we weren't able to discharge anyone. So that was a neat opportunity to talk about that. You can see the learning objectives here on the screen. I have 2 from the cognitive domain and 3 from the affective. What I was really looking for with this post-conference was for the students to do a nice review of diabetes, comparing type 1 and type 2. We talked about the pathophysiology as well as the treatment differences there. We talked about some labs that we monitor for our diabetic patients. And then within that post-conference, we really talked a lot about the educational needs, the importance of collaboration with the healthcare team. And then I was just watching them really demonstrate effective communication with one another. And then we touched on different ways that we can demonstrate empathy and caring to those diabetic patients at the time of discharge. So I really felt that the students met these objectives very well. And overall, they really helped guide the learning experience during the post-conference. So 2 teaching strategies. First, I created a case study for the students that acted more as a review before they came to the post-conference, and then a facilitated discussion during that time together. So the case study, you can see it's in the sandbox. You can grab a copy of that. Just a nice review for them again on pathophysiology, labs, dietary needs, that kind of thing. So the expectation was that they would work on that. Some students worked on it right during the clinical day, which was fine with me. And they needed to just have that completed when they came to the post-conference. Sorry for the small print, but I just wanted to kind of throw up the discussion guidelines. So I do have a copy of this in Sandbox as well. But just something for the instructor to kind of keep everyone on task and kind of hit the high points in the discussion. There is also a rubric that we'll touch on next, but just the expectations of the students during that discussion time. So again, this was a nice review to talk about diabetes, talk about the patients when they're going home and kind of the expectation that they'll be able to manage their own care successfully. So overall, it was a really great discussion that we had. So a couple different ways to assess their learning. Again, there's a discussion participation evaluation. So just a short sort of satisfactory, unsatisfactory rubric that really just I was looking at, were they participating, were they offering different suggestions, or were they just kind of sitting there quietly? Most of the students participated just fine. I had a couple students that are just a little bit more shy in general, but overall, everyone was involved in that conversation. After the post-conference, they were required to complete a concept map. So I was just looking for kind of right in the center, or however they wanted to do it really, but to organize their thoughts about the specific educational needs at discharge for a diabetic patient. And then that was submitted along with their weekly paperwork for clinical. I also had them do a self-evaluation, but this is something they always do every week. And so I just asked them to kind of add a few things about the post-conference itself within that self-eval for the week. So here's just an example from that discussion rubric. It really was just kind of a pass-fail type activity. So participates in group discussion to identify discharge needs of the patient. Were they, highly satisfactory in that, satisfactory or unsatisfactory? So there's a few different behaviors I was watching for during the discussion and then assigned a grade accordingly. And then here you can see the rubric for the concept map. So it kind of told the students what I was expecting of them and gave them a little bit of direction while they were completing that concept map. So again, here is that self-evaluation form that the students do every week for clinical. So I just asked that they added a little bit of a reflection about the post-conference itself. So overall, the post-conference went really well. I was happy that the students completed the case study and they kind of went along with everything I asked of them. Obviously, this post-conference was much more structured than what we normally did in post-conference, which was just more of a rehashing of the day. But the students did awesome. They were pretty excited to kind of learn about that, and I was really open with them about how I struggled as a new nurse, working with doctors and social workers and different people to discharge a patient, whether that was to their house or to a nursing home or whatever. So it was a great learning opportunity for them, and I felt like it was a successful post-conference overall. Thanks for listening.